Okay, now I'll be auscultating the carotid arteries in the thyroid. So, Maureen, what I want you to do, and for this we use the bell, I would like you to take some breaths and hold it when I tell you to, and then I'll start listening. Okay, go ahead and take a deep breath and hold it. Good. Let me come around this way. Go ahead and breathe. Give you a few breaths to catch up. Okay. Deep breath and hold it. Good. So we noted no bruise in the carotid arteries. I'm going to go ahead and listen to your thyroid, but can you swallow for me so I can locate it? Good. Okay. So take a breath and hold it. And again, no bruise noted. Okay, so now I'm going to assess your upper extremities. I'm going to go ahead and inspect and palpate your hands. There's no bony deformities. Skin looks great. It's clean, dry, and intact. And there's no lesions, no bruising, nothing. Just going to lift this up. Make sure you don't have any lumps, bumps, anything like that. No, your arms are symmetrical. I don't see any enlargement or edema anywhere. Hands look good. Okay. So now what I want to do is just feel around on your shoulders a little bit. Okay. Your shoulders feel very symmetrical. I didn't note any lumps or bumps, masses, anything like that. So I'd like to look at your nails next. You have good capillary refill, less than 3 seconds. Nails look good. There's no breaking. There's no splitting. The angle is normal. Again, good cap refill on this side. Nails are strong. There's no splitting of the nails at all. Okay, and your skin is appropriate color for ethnicity. So now what I want to do is I'm going to assess your radial and brachial pulses bilaterally. And they're 2+ regular pulses. The brachial is the same, 2+, regular. Okay, so now I'm going to take a look at your back and your posterior chest. And I'm going to go ahead and look at the skin and the thoracic configuration. So skin is intact. She's got some freckling to her back, but nothing open, no sores, lesions. Thorax is symmetrical. Okay, now I'm going to palpate and percuss the costovertebral angle. Let me know if it hurts at all. Anything? Okay, very good. Okay, she has no lesions on her back, no bruising, nothing. Just skin is intact. Okay, so her scapulas are symmetrical as well. Any pain or discomfort when I palpated anything? Okay, so now I'm going to observe you breathing, so go ahead and lay back. Okay, I'm just going to observe your respirations to see that you have a regular chest rise and fall. You're not using any accessory muscles. Okay. Very good. Breathing looks good. Okay, non-labored, regular, easy, and symmetrical. So now I'm going to palpate for expansion and tactile phremesis. So I'm going to place my hands on your back And please take in a few deep breaths for me. I want to see if my thumbs move symmetrically. They do. Okay. And I see no difficulty in breathing. She's relaxed, breathing easy. Okay, so now I'm going to check for tactile fremitus. Palpate for tactile fremitus. I'm going to palpate both sides of your back simultaneously and symmetrically. And I'd like you to keep saying 99 until I stop palpating.
99, 99, 99, 99, 99.
Good. Okay, so I felt symmetry and vibration. So next I'll percuss the posterior chest bilaterally. So I did a total of 10 spots, and I heard resonance throughout all the lung fields. So now I'm going to percuss the lateral chest wall, if I may. Good. And again, resonance was heard. We're doing this in a total of 4 spots. Okay, so now we're going to do diaphragmatic excursion. And for that, I need to grab one tool here. Okay, Maureen. So I'd like you to take in a deep breath and hold it. Now I'm going to percuss along your scapular line. Until I notice that there's dullness. Okay, go ahead and breathe. Go ahead and take in several breaths. Exhale as much as possible, and then hold it. So I'm noting the change of dullness to resonance. Okay, go ahead and breathe for a few cycles. I'm going to do the same thing on the other side. I'm going to go ahead and measure that. And this one is about 3.5 centimeters. So I'm going to come on your other side and do this again. Okay, so take in a deep breath and hold it. And again, I'm going to go along the scapular line until I locate dullness. And I'll mark that with a marking pen at the scapular line. Okay, I noted the change to dullness from resonance. So I'm going to go ahead and mark that. Okay, go ahead and breathe. Take a few breaths in, and then I'll go ahead and check the next area. Okay, so now I want you to take a couple breaths really deeply in, and then exhale as much as possible and hold it. And now I'm noting a change from dullness to resonance. Okay, I'm going to go ahead and mark that. Measure. Okay, and that's again about 3.5 centimeters. So 3 to 5 centimeters is average. So now I'm going to go ahead and auscultate the posterior chest, and I'm going to listen side to side so I can see if there's any changes. And we use the diaphragm for this. So deep breath in and out, please. And we do this for 10 spots on here. And her lungs are clear to auscultation bilaterally. I didn't notice any adventitious breath sounds. So now I'm going to go ahead and I'm going to listen to the front of your chest for a total of 8 spots. And I'm going to be comparing side to side. Deep breath in and out. Two more. Very good. So we listened for a total of 8 spots, and throughout her lung fields, her lungs were clear to auscultation. So now I'm going to look at listen to the lateral sides and compare those side to side, see if there's any changes. And we're going to listen in 4 spots. Good. That side is clear to auscultation. I'm going to come around here. Deep breath, please. Good. Yeah. Okay, now I'm going to inspect the skin of her anterior chest. So I'm just going to go ahead for purposes of privacy and just look down. And her skin is warm, it's clean, dry, and intact, no lesions, nothing noted. She's having no difficulty breathing. Her chest rises and falls symmetrically. She's not using any accessory muscles or feeling the need to be in the tripod position. Do you feel any dyspnea? No? Okay, very good. Okay, so I'm going to check now for pulsations or heaving. And what we're worried about with this is a AAA or an abdominal aortic aneurysm. And I don't feel any pulsations or heaving. So next I'll palpate the chest wall, starting with the apex, left sternal border. And And I don't feel any thrills, heaves, or pulsations. So now I'm going to locate the apical impulse. For privacy purposes, I'm going to listen underneath the gown. And I'm just going to listen for a while. No adventitious sounds. Okay, now we're going to go ahead and check for tactile fremitus on the front. So what I need you to do is just repeat 99 as I palpate.
99, 99, 99, 99.
Good. Okay, so I did feel symmetrical vibrations. There was no lag, anything like that. So now I'm going to palpate the infraclavicular and axillary nodes again. I know we did that with an earlier assessment, but we're going to go ahead and do that again. I'm going to do it bilaterally. Any pain when I press here? Okay. Axillary nodes. Any pain?
No.
Any discomfort?
No.
Okay, so I didn't note any swelling, redness that I could see. No edema, no red streaks, nothing of that sort. So now it's time to symmetrically percuss the anterior chest. So there's going to be 8 spots on there that we percuss. I'm actually going to come around to your right if that's okay. This is a total of 8 spots. Okay. All right, so now I'm going to go ahead and auscultate your heart sounds. And there's some points that we're looking for. We want to listen to the aortic, pulmonic, Erb's point, tricuspid, and mitral valve. Good. She's got a normal S1, S2. I didn't hear any gallops, clicks, rubs, murmurs, nothing like that. No friction rubs, snaps. I'm going to go ahead and listen to her lungs on the front as well. Deep breath. Again. Very good. So no adventitious breath sounds heard during that. Everything sounded good. Her lungs were clear to auscultation everywhere that I listened. So we're going to move on to the abdomen, and for that you want to be on the right side. So first I'm just going to inspect her abdomen. Yes, please. And what I'm going to be looking for is characteristics, contour, pulsations, and movement. So first I'm just going to look at her abdomen. I'm going to pull this down just a smidge. And she has no bruising, no ascites, We've got a scar here that's old, looks well approximated. Must be from a previous surgery. Her skin color is appropriate for her ethnicity. There is some striae from previous pregnancies, but it is shiny and silvery kind of colored. The venous network is visible in her abdomen. I don't note any lesions, nodules, masses, anything like that. I like to do bimanual palpation. Okay. I'm going to listen to her bowel sounds. We want to listen in all 4 quadrants. Very good. Okay. So she has positive bowel sounds in all 4 quadrants. They were not hyperactive or hypoactive. So now we're going to move on to the arteries. And the first one we're going to listen to is the aorta. And we use the bell for this. We're listening to make sure that there's no bruit. There's no bruit heard over the aorta. Now I'm going to auscultate the renal arteries. I'm not hearing any bruits. Then I'll go ahead and auscultate the iliac arteries. No bruits heard. And last but not least, we're going to auscultate the femoral artery. Very good. Sorry, tripping over your sheet there. Okay, so now we're going to do some percussing. I'm going to go ahead and lift this gown up and keep you covered up. So first we're going to percuss for tone. We're going to do the liver borders and splenic dullness. So the liver runs from the right over to the left. So we're going to go ahead and percuss the liver borders. Dullness is generally heard over the portion of the liver, the greater portion. And there's tympany also associated with the liver. And I didn't feel any masses as I was going through and percussing, but over the stomach and intestines, it's tympany that you will hear. Okay, so We want to now assess for splenic dullness. And spleen is actually going to be on her left-hand side. Kind of hangs out underneath where the liver is. We'll go ahead and assess for splenic dullness. And you can hear the dullness. Alright, let's pull this down for privacy purposes. I always like to be on the right-hand side. The dullness from the spleen is heard from the 6th to the 9th rib generally. And there's a trob space too that sounds tympanic. Okay, so when you want to measure the liver borders, you start at the right midclavicular line over an area of tympany, proceed to an area of dullness, then percuss up along the border. Sorry, I think our computer shut down. And a normal size for the liver will be between 6 and 12 centimeters. So it's very, I want to say it's going to vary from person to person what they think size-wise. But usually for a female, it's less than 10 centimeters. Okay, so now I'm going to go ahead and do some palpation. So I want you to lie as flat as possible. And is it okay if I go ahead and press on your stomach? And I'm going to palpate in all 4 of her abdominal quadrants. And what we're feeling for with light palpation is any like superficial type masses, any lumps, bumps, nodules, anything of that sort. And our abdomen is smooth and soft. Any areas of tenderness so far? Okay. And she has no guarding. She said it's non-tender. No tenseness, no rigidity. And now next I'm going to perform some deep palpation. So let me know if any of this palpation is causing you any discomfort, okay? So I'm going to palpate in all 4 quadrants. This is to feel for any masses or nodules you may have missed with the light palpation. And generally it is a little uncomfortable for the patient. I'm not feeling any lumps or nodules. So yeah, no masses or anything noted on the left or right costal margin. And any of this hurting at all, Maureen?
No.
Okay. Alright. So now I'm going to kind of go ahead and palpate her kidneys. They're kind of hard to find, but does that hurt at all?
No.
How about that?
No.
Okay. So yeah, her kidneys, right and left, were free of any masses, nodules, or lumps. So now I'm going to check the midline of her abdomen. I want to see if there's any aortic pulsations present. So you can do that by simply palpating. And again, with that, we want to make sure that there are no pulsations, because that could indicate that she may have a abdominal aortic aneurysm. So I'm going to go ahead and palpate the midline. And I'm not feeling any pulsations. Am I causing you any tenderness, any discomfort, pain? Okay, very good. So now we're going to kind of go through and I'm just going to check your abdominal muscles. Sometimes, especially in pregnant women, the rectus muscle will start to open up a little bit. So I just want to make sure that you have even muscle tone. Yep. She has even muscle tone. No tenderness with that?
No.
Okay. Muscles were symmetrical, equal in strength bilaterally. I'm going to go ahead and cover you back up, Maureen. Alright, so now we're going to move on to the feet and legs. So I'm going to go ahead and uncover your bottom part here. I'm going to pull her pants up as far as possible. And just observe the legs for symmetry. You want to make sure that one leg isn't larger than the other leg, because that could indicate that there's a clot on there. And her skin is warm, dry, intact. She's not sweating. She doesn't have any moisture on her skin. Her skin isn't dry. It feels well moisturized. The hair distribution is even on both sides. Temperature is warm. No edema is noted at all. And I'm going to go ahead and take your socks off, okay, Maureen? That way I get a little bit better view of your feet and everything. Right now I'm assessing her dorsalis pedis pulse. And it's regular, even, 2+. I'm going to go ahead and move up a little bit. And this one's harder to find, the posterior tibial. So I apologize if I'm tickling you in any way. And again, the pulses are even. I would rate them as a 2+. They're regular. And now we're going to go for the popliteal, which is directly behind the kneecap. Kind of have to search around a little for it, but it's there. And that's 2+ again, regular, not bounding. Very good. Okay. I'm going to go ahead and pull your pants legs back down. Okay. Now you can go ahead and sit up for me, Maureen. I'm going to go ahead and do a neurological exam on you. Can you tell me your name?
Maureen.
Can you tell me your full name? Sorry.
Maureen Dunchak.
Okay, and what's your birthday?
12/19/79.
Okay, and where are we right now?
We're in St. Louis, Missouri.
And what exactly, where exactly are we?
Ballin.
Ballin, very good. Okay, and who is our president?
Barack Obama.
Good. Okay, so I'm going to ask Maureen if she has any numbness or tingling in any of her extremities.
Nope.
Okay, so she's not having any altered sensations or anything.
Nope.
She's alert and oriented ×4.